Welcome to the Indiana Athletic Trainers Association podcast. The IATA is dedicated to advancing the profession of athletic training and empowering membership through advocacy, education, networking, and innovative resources. To find out more about the IATA, check out our website and social media pages. The views and opinions expressed by speakers, guests, or others who have provided materials to and for this podcast are not necessarily those of the IATA. The IATA assumes no responsibility for, nor endorses any of the comments, recommendations, or materials that are provided. Hi, everybody. Welcome back to the IATA podcast. My name is Daniel Welty and hosting this episode. And I am excited to talk about the 2026 IATA Annual Symposium. And I have two committee members from the Professional Development Committee, also known just as the PDC. And I'm thankful to have Kaylin and Louie on to the podcast. Welcome, both of you.
Thanks for having us.
Thanks for
Excited
having
to be
us.
here and talk to you.
Well, great. And Louie, since you're talking, we'll just have you introduce yourself really quick, and then Caitlin to follow, or Kaylin to follow.
All right, I'm Louis Rush. I'm an athletic trainer in an occupational health space in Southern Indiana, kind of closer to like Evansville area-ish. And I've been in that role for around 6 years now, so a little bit different in that different space than a traditional athletic trainer.
And Kaylin?
I am Kaylin Caudry. I have been certified for 4 years now and on their professional development committee for 3. And I work as a middle school athletic trainer in Central Indiana as well.
Perfect. And again, thank you both for joining. And we just want to talk a little bit about the symposium, let people know kind of what's going to be happening, and just kind of get people excited and let people know that registration's open. It's time to go register, and make sure you get there early for the early bird pricing, and make sure don't register too late. Obviously, you're going to be paying more for some of that. So I just wanted to talk a little bit about that today. And so let's just start with some of the basic information. Can one of you tell me the day, the time, as well as the location of this year's symposium?
All right, it's going to be on Sunday, June 7th. Registration starts at 7:15 a.m. at Forte Sports Medicine in Carmel, Indiana, up in the Indianapolis area. It should be a great day of learning. Again, that registration starts at 7:15. You can get registered on the IATA website, and I'm sure Kaylin can talk about this a little bit more. There will be some stuff going out on social media here that everyone should be keeping a lookout for.
Yeah, so there should be a social media blast. I have worked with our social media coordinator on this. So I would keep an eye on the IATA socials for links to register. That would be Facebook and Instagram.
Perfect. And when it comes to registering, obviously all done on the website, and places that you can go to register there. You'll find links on the website. Kaylin, can you tell me the cost for the symposium? I know there's a lot of different membership levels that we have, or membership depending on if you're a Hall of Famer or past president or certified student or something like that. But let's just talk about a regular certified member. What is the cost for the symposium?
For a regular certified member, you're going to be looking at $130 for the symposium up until June 1st. After June 1st, that does raise by $5.
Okay. And then, so what a lot of people want to know, what, the bang for their buck, as far as that goes. And we'll dive a little bit more into the schedule. But Kaylin, can you tell us a little bit about what individuals are getting for that $130?
Yeah, so with your $130, that covers your registration for the symposium, which you will receive 7 CEUs for. And we have lunch included as well. It looks like it is the same lunch as last year, which is Panera catered box lunches. So you'll have the option to pick what you want when you register.
And she's
Perfect.
forgetting the most important part. There will be coffee at the symposium this year that everyone will be able to partake in. It's 100% going to be there this year. No backing out.
Yes,
So
we have
come
guaranteed
thirsty.
coffee this year because we all know a lot of us need caffeine.
Absolutely. Yeah, I was going to bring that up. We were chit-chatting right before we hit the record button, and we were talking a little bit about coffee. So, we're glad that's on the menu this year, and excited to get to be for the symposium to be here and to do that. One of the things I always find interesting, and as many people know, that I was previously a co-chair of the PDC and worked with Caitlin and Louis on the committee, and the committee puts in a lot of work. It doesn't come easy to bring up the symposium and find speakers and get people to come and present some great information. But one of the benefits I find is that with it being, a state, and mostly people that come to this are IATA members or those athletic trainers in Indiana. So travel costs are minimal, and travel time is usually minimal. And because it's not a multi-day event, you save money on hotel fees. And so I think, really for seven CEUs and $130, as well as breakfast, coffee, and lunch, I mean, that's a pretty good value when I look at it. You go to some other multi-day symposiums. And yeah, you might be getting more CEUs, but by the time you take registration fees and hotel costs and travel, I mean, plane tickets right now are extremely expensive. And so I think when people are looking at the value of the symposium, I think that's one thing just to take in consideration
I was
from
thinking to
that
hang out with
regard.
the three of us all day. And who would want to pass that up? You're forgetting the most important part, Daniel.
Well, there's a lot of value in that. So, and people know I'm running around with the camera too, so smile. But what other value would you say that this symposium brings, whether it's, fiscally or not? What other values would you guys say that, you can benefit and get out of this year's symposium?
I think one of our biggest values, just as the symposium, is that we're a very hands-on learning lab kind of first symposium where you come in, we got our learn today, apply tomorrow, where you come in, you learn the skill, you to actually apply it on whoever you're with or somebody else that you meet at the symposium, get a network, get to try it out, and then maybe on the next day you can try it out on your own, either athletes or in my case, workers who get to see something new, and hopefully you'll be able to develop in a way that is meaningful to you um, after one day of training.
Absolutely. So, we talked a little bit about the learning labs and those types of things, and one of the things that looks like when I looked at the schedule that we're going to start off with is a keynote speaker. And so if you guys could just talk a little bit about, it looks like maybe an hour block there for the first session after breakfast with coffee. And so could you guys talk a little bit about that first session as we start the symposium at 8 o'clock?
Yes, so that first session, so we wanted to just be able to start and welcome everybody to the symposium. And then once that welcome is done, we are going to go into a first session with a keynote speaker. That way, everybody can be in the same room to start. And that's going to focus on different supplements. We've noticed a lot of athletes in particular are drinking energy drinks, trying to supplement. We thought this was an area that everybody, regardless of setting, could find useful in some way, shape, or form.
I mean, that goes the same for the occupational health setting too. I know a lot of people may think, what do you use that for? But all the workers I work with, all they're constantly asking me about energy drinks, supplements they can take to keep them awake and alert, especially when they have those night shifts and those other kind of odd hour days. So it's a pretty important topic that can really touch on every level of athletic training. So we think it'll be a good thing to get everyone together for that one before separating into our learning labs that we have coming up right after that.
Yeah. And I love how you guys just there talked about your different settings, and obviously you're very familiar with your setting that you work in, and but I think it's important for people to also understand is that the symposium, while some topics may be geared to a certain target population, it can be applied in all patients that we work with. And so I think there's a lot of value in that. And so I think as we talk a little bit more about each session, or when people go to look and register for the event, know that there's always something that you can take away from that as well. And then also too is some depending on your setting, you may not have certain skills that you use every day. I work in the physician practice setting, so I'm not doing manual therapy typically. And so some of the things that like doing is manual therapy, but I don't get to do it every day. But and if you go back and listen to our BOC podcast that we did, one of the things is we all have to be competent in all of the skills in athletic training. Some of us are more experts in certain areas, but we all have to be competent in certain areas. And so, if it's something that you haven't touched on in a while in your development, that also might be beneficial. So I think there's a lot of value. Rather, you may look at it and go, "Well, I don't typically do that," or "That's not my patient population." Look at it from a broader scale. Well, both Kaylin and Louis both talked about and how you can apply these topics specifically to your patient population.
I think that's a good point too, because if you think you're learning something, you're like, I don't know how I'd apply this. Well, the great thing about being at an in-person symposium is being able to talk to other people about how they would apply it or do apply it in their current practice. For instance, as occupational health, for a lot of those things, I have to kind of ask around about how people are using it so I can figure out how to best utilize it in my practice. I know a lot of people think they're limited, especially in the occupational health setting, but I can tell you that really we're not, especially in Indiana. There's a lot of different rules, different places, but there's a lot of things that I learned at the symposium that I applied the very next day, and it's all about just kind of changing that mindset of how from a just watching mindset to actual learning it. I think that hands-on part really helps with that.
Absolutely. And so let's kind of dive in as we know we're kind of just working through the top down through the day of the schedule. And so kind of if you guys want to talk about the next sessions at 9 o'clock, and it looks like people have a choice that they get to choose between a couple different sessions there. So I'll let you guys kind of just run and talk a little bit about the rest of the sessions for the morning.
Yeah, so at 9 o'clock, attendees will have the option of attending an emergency management lab or an opioid overdose lab. In that lab, it is actually ran by Overdose Lifeline. So they are going to do Narcan training and really focus in on how to manage an opioid overdose in that lab. On the other hand, we have like an emergency simulation type of lab where you're going through different emergency skills that you would see more frequently on the sideline as an athletic trainer, or really in any setting.
Yeah, I think those emergency preparedness, that would be a good one for a lot of people who are in kind of different settings, especially one like mine, where you might be the only person there who has that background, that healthcare background. And honestly, I haven't done emergency stuff in a really long time, but I know if anybody goes down where I'm at, they're all going to look at me. So it's always good to get those refreshers on stuff. I'm excited for what we have coming, and especially in that for that emergency prepared one. The opioid overdose is another big one. Again, I'm with a lot of people who are trying all kinds of different ways to stay awake. So that is always great information to have, and I'm just so glad that we get those in our symposium this year.
And then if you guys want to just maybe roll right into the 10:45, the next set of learning labs.
So
Okay.
at 10:45, we have a cervical spine manual therapy lab and an upper extremity PNF lab. So those are a lot more of your like treatment-based labs that we have for the day after that block of emergency management.
What's great about both those labs is that they're both taught by some very, very knowledgeable people. One of them could be one of them was one of my teachers whenever I was in school, Jackie Kingma, as well as some of her students who are with her. So I'm very excited to see her talk. She was one of my biggest inspirations when it came to manual therapy. So seeing her talk about manual therapy is awesome. And then we have Daniel Barber talking about the therapy of the cervical spine. Another big thing that I think a lot of athletic trainers get a little scared of before they start to work with it. And so getting more information on that is something that I always enjoy. I don't know about you guys, but I always think it's good to have that kind of knowledge of the cervical spine and those things that, are a little bit more, you get a little bit more skittish to treat, especially when you're a young athletic trainer or somebody who doesn't see that stuff very often.
Yep, absolutely. So a lot of good learning labs for the morning, and then we break for lunch, which is always a good time to do that. And I heard Panera box lunches, if I heard that earlier. Is that correct?
Yeah, so it looks like it's the same as last year, which was a Panera box lunch. When you go to registration, you'll be able to click out of like 5 or 6 different options.
Perfect. And then as we kind of roll into the afternoon, more learning labs happening. And so if you guys want to just talk about the 1 o'clock and the 2:45 labs.
Well, the 1 o'clock has one of our other great presenters presenting at that time, as Kaylin will be giving us her talents to teach everybody, as well as she'll be with Felicia Cooper at that time to talk about the SI joint and evaluation and management of it. She's probably got way more to say about that than I do. Also, we'll have Jacob Crow presenting on advanced hamstring and rehab techniques. There's been a lot of changes and updates in how we treat hamstrings. A lot of people kind of have their own way of treating them right now, and I think his presentation is really going to show us some new things that maybe people haven't been doing here recently, or maybe haven't thought of that could be really helpful in that space. Very exciting labs, and make sure you come dressed and ready for those because you don't want to be working with the SI joint or hamstrings in your jeans. So come dressed for learning labs. That'll be perfect.
Well, Caitlin, do you want to give us any inside scoop or any cool things that you want to talk about or that you're going to be talking about? I know you could probably go on for maybe a whole hour, which it sounds like you'll have plenty of time to do at the symposium, but maybe any little thing that you might want to bring up that gets people excited and why they should come to your lab.
Yeah, so I'm really excited to facilitate this lab along with Felicia. So we're going to go through a general overview of SI joint biomechanics and then also the SI joint cluster test, so the clusters of Lissette. And then from there, we're going to go into, I think, 10 or 12 different manual therapy techniques to treat the SI joint depending on what is going on. So this is going to focus a lot on, okay, so we see that this is going on biomechanically, so this is the intervention we apply. So I'm hoping that attendees will be able to leave the session and use that hopefully on Monday.
Yeah, absolutely. And then at 2:45, it looks like there's a single session, but still a learning lab. Is that correct?
Yeah, so at the end of the day, we thought it would be best to kind of bring everybody back together again. And we thought, what better way of doing that than a learning lab based on yoga, where people can relax a little bit and have some time to really think about using not only utilizing yoga and meditation in their own practice, but also kind of getting to do some of that as well before they take off for the day. We thought it'd be a good way of bringing everything together and kind of wrapping up at the end of the day. And we're pretty excited about this. Our speaker is very knowledgeable and teaches this stuff regularly, almost daily, I believe, and utilizes it in her own athletic training practice as well as being part of a yoga studio as well. So, very knowledgeable speaker that we have for that. And that's Shannon Hamilton, Dr. Shannon Hamilton. If I'm trying to get everyone's names in there, I hope I didn't miss anybody.
And then obviously we conclude around the 4:15 mark again, which I just want to bring up is that yeah, maybe some people coming from the corners of Indiana, maybe a little bit early start for you all, or maybe those that are on a different time zone, a little different there. But hopefully that 4:15 end time gives you plenty of time to get back home, and at least get ready for bed and ready for Monday. So I think for the day and everything that goes on that day, and obviously all the wonderful topics and speakers, and again, I think what you guys talked about is the translations between every setting. And while we all work in different settings, we've always talked about as a profession, a lateral ankle sprain is a lateral ankle sprain. Now, it might change a little bit depending on the age of the patient or mobility and those types of things, but at the end of the day, an ankle sprain is an ankle sprain, and we manage it in a very similar fashion. And I think this can give us insight to a lot of different areas, but I think also very applicable to our specific setting and our specific patient population that we get to work with every day. And so I think Louis, you mentioned something about lab clothes. Should I just come in my lab clothes or do I need to change after that first session? What's your guys's policy, I guess?
We encourage everyone to come in your lab clothes. It's an early morning. It's a day where you're going to be moving around all day. Um, just come dressed, ready to move. And usually, we're not going to judge anybody based on their lab clothes. Everyone's going to be dressed just like you, so don't worry about it at all. Just make sure you feel comfortable in what you're wearing and that you're comfortable actually doing some of these learning labs and letting people utilize you as a model and utilizing other people as a model while you're practicing all these techniques. So I always advocate for sweats and a t-shirt, but it's also the middle of June, so you might have to go some shorts on that too, just depending on what kind of person you are.
Yeah, and then as I kind of looked at the schedule here on the IATA website, I think you'll see some of it says Learning Lab, and then the other side says Rehab Center. But those are both learning labs, correct? It's just it
Those
depends
are
on the
those
space.
are Yeah, those are talking about the space as it's defined in Forte. So our learning lab space is actually the rehab space of Forte, which you're in a rehab room with rehab tables. Uh, or did I get that wrong?
The rehab space was the like normal functioning PT clinic that we will have access to. And then the learning lab space will be upstairs in that classroom, and it will be divided where we will have tables as well as the desks.
Okay.
That's why you guys shouldn't let me talk. I don't know what I'm talking about half the time.
Well, I figured with two people on here from the PDC, we would get it all worked out. So, but
Both areas are set up very well for a learning lab, though. Anybody who's been there before knows how we set that up, where there are treatment tables on both sides, and we have monitors to put up any of the PowerPoints or anything that a speaker might need. So it ends up working out very well.
perfect. And when I also looked online, it looks like there is, a limit to the amount of people just based upon size, as well as obviously we don't want 100 people in a learning lab. So space is limited, and so people should sign up early and get signed up and those types of things. Is
Space
there
is
any?
limited both ways as far as the max number of people who can come and the max number per learning lab. So if you want to get your best choice of learning labs, you want to get on there early and make sure you're signed up and ready to go so you get to see whichever speakers and presentations you want to see the most.
Is there anything that you guys are personally excited about the symposium? Obviously, you guys get to see kind of all of this come together, and you get to overcome some challenges and deal with some things, and then and build this symposium, and then you get to see it all come together on that day. Is there anything that you guys are personally excited about? And Kaylin, you can't say your topic, so.
I can go first. I'm pretty excited about the yoga part. I need some yoga in my life. I'm not going to be able to be as flexible nearly as anybody else there. I know that. but I definitely need that silent meditation in my life too. All the breathing techniques, I need all that relaxation. I'm pretty excited about that. And even though Kaylin's not allowed to talk about hers, I'm pretty excited about the SI joint stuff too. Occupational health, everyone is complaining about their hips and back, so that is a great lab that I am ready to participate in.
Well, thanks, Libby. I'm also really excited for Shannon's yoga. I have attended her yoga sessions before because she did them for us as a student, and they are some of my favorite things to attend. And then I'm also just excited to get to see the people that I don't see every day. Like even when it comes to like our committee, we're pretty spread out across the state. So I see Louis once a year at the symposium. I see Vince once a year at the symposium. So getting to see people like that, getting to see people that I haven't seen that hopefully I'll get to see some of my undergrad connections as well.
Yeah,
That's why we
absolutely.
jumped on this too, because this makes two times for Daniel this year for me, which I'm pretty excited about. Usually I have to wait all the way till June, so this is good.
Well, I'm just a phone call away, Louis. You don't have to wait that long.
I mean, to see your face, you know.
Oh yeah. Oh,
Yeah.
okay. Okay. I'm a FaceTime call away. So, well, I think that's I'm always excited about that too, seeing people I haven't seen, especially in person, right? Obviously, we all love the benefits of Zoom and what it provides, but there's something when you can just see people, face to face and get to chit chat with people and catch up, and that's always a fun thing, and because life changes, and it can change rapidly. And things are always on the move, and things are always changing in athletic training, whether it comes to us personally or how things are developing in the profession. And then obviously things that, obviously are going to be talked about at the symposium, different care, different treatments, evaluations. There's always something popping up to get us to be better for our patients and the clients that we get to have a pleasure of serving every day. And so again, I'm excited, hopefully just as much as you two are and everybody else, for the IATA Annual Symposium, which is going to be on June 7th, and that's a Sunday, a one-day packed-filled symposium. Again, I think reiterate with coffee. So,
We'll put
well, is
that
there
on
any?
bold letters on Instagram as well, just so everyone knows.
With coffee.
Well, is there anything else that you guys wanted to add about the symposium or anything that we didn't cover talking about? I want to make sure everybody is aware of everything going on.
I think we did a good job covering it. For anybody who is looking and wondering, yes, that 7:15 start time is a little bit earlier than before, and it's just slightly later than before. But this is one more extra CEU than we've had in the past. So hopefully that makes people feel a little bit better about the value of this symposium. We really thought that was important to try to squeeze out another CEU here, and we think that'll be good for everyone who's making the trip up or down wherever you're from.
Yeah, I think the only other thing I'd like to add is I don't think we got a chance to highlight our 9 o'clock speakers other than Justin Phillips from Overdose Lifeline. So that emergency readiness lab will be ran by doctors Cam Powden and Stacy Gavin. So I'm really excited to see what they do to put that on.
I told you not
And
to let me forget anybody, Daniel. We're close. Good thing Kalen's
hey,
on
hey, I'm just the host here, so.
it.
Well, before I let you guys go, I do a fun question with everybody that comes onto the podcast. And so, Kaylin, I'll start with you. If you could be an animal, what animal would you be and why?
Okay, so I was thinking about this, and I'm thinking that I would go with a corgi because I feel like it embodies my like personality. Because I am very small. For those of you that have seen me in person, like I am 5 foot tall. But I can also be like super like fierce when I need to be. So my mind went to a corgi.
Very nice. And Louis?
Well, I'm like the exact opposite of that. So I said koala because I recently learned a koala like eats half its body weight in food every day, then sleeps the rest of the day. And I feel like that's me. Just try to eat and sleep all day. So that's that's what I'm going with. At
That's
least life
awesome.
goals. Maybe I don't get to sleep all day, but we can
Okay,
dream.
but I mean, that is a life goal.
Well, I appreciate you first of all, I just want to say thank you for both in your role of the PDC. Again, one of those committees I think people don't always understand the work that goes behind the scenes to put an event like this on. And so I appreciate the work that you guys do on the PDC, and then appreciate you guys coming on the podcast today. And so just one last plug, make sure people go out to the IATA website, check your email, check the social media coming out, all the things. There'll be plenty of information pushed to the IATA members about the symposium that will be held at Forte Sports Medicine and Orthopedics in Carmel on Sunday, June 7th, 2026. And thank you guys again.
Thank you, Daniel. Appreciate you doing the podcast. And you're also one of the people who recruited me to this role. So if anybody doesn't like the symposium, I'm pointing at you.
I will take any and all complaints. So,
Yeah. Thank you for having
alrighty,
us on the podcast.
not a problem. Thanks again. Thank you for tuning in to the Indiana Athletic Trainers Association podcast. We appreciate you taking time to listen and look forward to you joining us again on the next episode. To find out more about the IATA or to get in touch with us, you can visit our website or reach out via social media.